understanding and my aha moment when I was in optometry school and in residency was, and even kind of my drive into being more plant-based, was how the back of the eye is a giant meshwork of blood vessels. And if you have diabetes, high blood pressure, all of these, if you are eating a bad diet and you have a poor lifestyle, you're not exercising, your blood vessels get damaged. And if the back of your eye is nothing but blood vessels, you're increasing your risk for hypertensive retinopathy from high blood pressure, diabetic retinopathy. You can get cholesterol plaques in the back of the eye. You can have a stroke in the back of the eye.
You are listening to Veggie Doctor Radio, and this is episode number 173. Welcome to Veggie Doctor Radio. I am your host, Dr. Yami, board-certified pediatrician, certified lifestyle medicine physician, certified health and wellness coach, author, speaker, mother, wife, and human being. I passionately believe in the power of diet, habits, and mindset in sparking and sustaining well-being and joy in our lives. This podcast combines expert interviews and thoughtful monologues to explore plant-based nutrition, lifestyle medicine, parenting, mindset, and other exciting and fun topics. I hope that these episodes inspire you, uplift you, and equip you with the knowledge and tools to live your best life. Are you ready to get started? Let's do it. Hey, veggie lovers. Welcome back to Veggie Doctor Radio. I have another fabulous episode for you today with Dr. Joesph Allen, who is an optometrist who is also YouTube famous. But he answers a lot of questions, talks about diet for eyes. It's going to be great. I know you're going to love it. But I want to remind you that the information on this podcast is for informational and educational purposes only. It is not meant to replace careful evaluation and treatment. So if you have concerns about you or your child's health, nutrition, eating, growth, your eyes, please consult a healthcare professional. So let me tell you about Dr. Joesph J. Allen. He is a practicing optometrist at the Pinecone Vision Center in Sartell, Minnesota, and is the founder of Dr. Eye Health, an educational YouTube channel with more than 400,000 subscribers, providing information about eye health, ocular disease, and vision products. His videos cover a range of topics that his subscribers frequently ask about: eye floaters, glaucoma, dry eye syndrome, contact lenses, eyeglasses, and more. Dr. Allen has been featured in Ask Men and Oprah Daily and was awarded the Media Advocacy Award from the American Optometric Association in 2021. In his free time, he enjoys rock climbing, running, playing video games, hiking, and biking. So in this episode, we talk about his eating journey, whether he considers himself plant-based, how he got there, why diet is so important for eye health. If people could change just one thing in their diet, what would it be? I love his answer. Hopefully you won't be too surprised. And what other lifestyle habits are important for maintaining eye health. We also talk about the myopia epidemic, the epidemic of nearsightedness. I am fascinated by this discussion we had about this and really have started thinking about it and how I'm going to counsel my patients. But it's a great episode. I know you're going to love it. I hope that you check out his YouTube channel, Dr. Eye Health. Lots of fun videos on there. He's a great speaker, a great educator. And thank you, veggie lovers, for being here. So without further ado, let's welcome Dr. Joesph Allen. Dr. Joesph Allen, welcome to Veggie Doctor Radio.
Hey, thank you so much, Dr. Yami. This is a huge honor and privilege for me to be here with you. Thank you.
Awesome. Well, as I was saying before we started recording, I met you on Clubhouse and I was very intrigued because I've only had one other eye doctor. I had an ophthalmologist on, but we didn't barely covered anything about eye health. We were talking about all kinds of other things like spirituality and stuff like that. So I thought it would be great to have another eye doctor on, and you're an optometrist. We can talk about eye health, but before we get into that, when I met you on Clubhouse, we were in a plant-based room. And so that was also very intriguing to me. And I would love to hear about your way of eating, your journey, how your diet has evolved over time. Do you label yourself in any way? So yeah, give me all the details on that.
So I do identify as kind of going plant-based. I've kind of waxed and waned in how strict I am with that, but I would say the vast majority, I'm probably in the upper 90% plant-focused. And I've been that way for the last 5-6 years since finishing residency. Mm-hmm. The way I found my way to eating a plant-based lifestyle was mainly because of my experience as a resident at the VA Medical Center here in Minneapolis, where I did my residency there in 2015 to 2016. And during that time, as perhaps you know, or any other doctors who maybe listen to this, like the experience in the VA Center, largely male population, older individuals, and a lot of people are sick. And like I'm working in the ophthalmology department, so I'm seeing everybody who's diabetic should be having an eye exam at least once a year. And almost every patient I had was diabetic, high blood pressure, cholesterol, erectile dysfunction. They're on depression medications, anxiety medications. They've had already 1 or 2 strokes. They have cardiac disease. They have kidney failure. It never would end. And it was, when I had somebody who was healthy, it was bizarre, right? But a few times, and throughout my residency, I would have probably less than 10 patients ever in that entire, in a residency for optometry. It's only 1 year. But in that experience, I probably had less than 10 people that would come in that were like 70 years old, they're mentally clear, physically fit, no medications, and I would ask each one of them, like, what is your secret? What's going on? How compared to everybody else, how are you doing this? And every single one said it was diet and exercise, right? And it was kind of that trope, and as a resident, it didn't click in my head until I finished residency, and then I started seeing patients in private practice outside of the hospital, and I realized people were still the same way. It wasn't just the VA. And I was like, is this just the way we are? Are we just destined to be sick as we get older? Like, is there anything I can do as an eye doctor? What should I be educating my patients about? And that's a whole other part of it, because we see so many diabetic patients, and it's part of our training. It's part of just standard of care that we have to educate our diabetic patients that you need to have tighter control of your blood glucose. The studies show that the tighter control you have, the less likely you are to have diabetic retinopathy, the less likely you are to have sight loss due to your diabetes. So I was like, well, what diets should I be recommending? And I realized in school you don't really get that much. So more or less, long story short, I ended up just diving into kind of more research, listening to more podcasts with cardiologists and other more health or nutrition kind of more focused medical professionals, and I found myself just reading more and more support for more of a plant-based lifestyle, especially when it comes to the heart and cardiology. So I said, you know what, I have a sister-in-law who at the time was been vegan and been kind of just really very supportive of that for years, and I always kind of laughed at it. I'm like, oh yeah, tofu, okay, haha. And I thought, you know what, it's not going to hurt me to try it. And I just jumped into the deep end of the pool, and within 1 to 2 months my eczema was clearing up. The GI issues I had since I was a kid, I had terrible GI issues, that started clearing up, and I had more energy, I was sleeping better, I swear I started thinking more clearly. Very anecdotal, but it changed me, and I really believe in it. So That's kind of my long story of how I found myself being more plant-based.
Wow, that's amazing. Well, and it sounds like you didn't even switch expecting for any of those conditions to change, did you?
I was kind of hopeful. Not necessarily the eczema aspect, but I was curious how my stomach would handle it, because again, I've had stomach issues since I was a kid, whether it be TMI, but too much either bloating or constipation, or regular bouts of diarrhea, and again as a kid all the way through high school, and the best part, which my wife loves, is that in college I had terrible gas, and bad enough where not my roommates didn't like it, but the guys down the hall who didn't even really know my name, they knew that I was like the guy with bad gas.
Oh my gosh.
It's potentially
embarrassing. Well, I gotta stop there, because I live with 3 men. Okay, so I have my husband and my 2 sons, and there's always this joke that guys are just gassy, right? If you had the reputation among other men that you were gassy, that's got to be pretty bad.
It was, and I'll even say, I think it hurt my chances with some girls in college that I was pursuing, because it was part of something I always had, was GI issues, and then finally, when I made that switch, it was scary to me how I wasn't bloated all the time, I wasn't gassy all the time, and then when I did, we're all human, and I love that you're part of your intro that you say you're human. That means so much. But yeah, we are flatulent, we have gas, and now I don't have as much gas, and when I do, it doesn't clear out a room. It one of the many benefits that I experienced, and I was just like, wow, so it must be like putting cleaner fuel into my system, that sort of thing.
Yeah, that's amazing. Well, I want to go back, because I think what you said about going to residency at the VA, and I'm a pediatrician, so I didn't really spend a lot of time at the VA, but my husband, he's an internal medicine doctor, so he did spend a lot of time at the VA, and I hear a lot of these stories, but I'd love to go back to when you commenced going to the VA. Was it shocking for you? Was it what you expected when you went to optometry school? Is that kind of what you were envisioning that it would be like to be an optometrist, to deal with all these chronic conditions, or were you expecting something different?
So when I went into optometry school, I think when I was young, when I was 13, teenager, and I started kind of getting interested in eye care, I had this kind of thought that, hey, I'm just going to do more glasses, contacts. I'll help people see their very best. I'll help kids get into contacts. It changed their life. I mean, it changed my life. That's how I became really in love with optometry, was getting contacts at the age of 13. It just, again, changed my life, opened so many opportunities for me. So I kind of envisioned that. And I was at a pivotal point when I was deciding in college. I was shadowing both an optometrist, and then I shadowed an ophthalmologist, and I was trying to decide which way do I go. Because with ophthalmology, it's more operating room or surgery. Mm-hmm. And so I shadowed that, and I nearly passed out. And so I found out as a good lesson, and this is something I recommend for anybody who's thinking, or maybe has a kid who is thinking of maybe going into healthcare of any profession, shadow. Ask doctors, ask what their lifestyle is like, because I don't think, I mean, I just don't, I am very skilled with my hands when I have a patient who's in the clinic and has a corneal abrasion, or they have a foreign body in the eye. I'm very good at removing that. And cataract surgery, that's not a problem, because there's almost rarely any blood you see. But when I was shadowing, we had a pediatric case come in for pediatric strabismus surgery, and as soon as I saw like a kid getting cut open, and at that time, I was like in early college years, I was like a sophomore in college, and I fainted there in the operating room. So, good lesson for me, lesson learned early on that surgery was not for me, so I was able to steer my track toward optometry. But then, just like you mentioned, once you get into school and you start hitting all the pathology, and with optometry, it's not just ocular pathology. You have to learn basically the first 1-2 years of med school and optometry, dental school. They're all kind of forming the same thing. You have to cover anatomy, pathophysiology, and not just, again, the eyes, but all over the body. And then pharmacology. But yeah, when it came to the disease aspect, and that's really what I wanted to do. I wanted to be able to like treat all the different infections, and it just, you start hammering things like diabetes. Like, wait, we have like 6 lectures just on diabetes? How severe is this? And then, of course, high blood pressure, and then you have Holland-Horst plaques and vein occlusions, artery occlusions. It never ends. But that's kind of where I found my love into it. And all of my professors, of course, that I looked up to and admired, they all did residencies, and they vouched for different programs. And some of my mentors, they all did residency programs through the VA, and they're all in ocular disease. So I kind of followed in their footsteps. But it helps me. I think it's enlightened a lot of my life to better understand myself by studying anatomy, physiology, and certainly with the eyes. So that's kind of how I found my way through that.
Wow, that's so interesting. Did you ever feel a bit disillusioned or depressed about the state of health in our nation as you were doing those rotations?
It is. There are times when you get frustrated and you start questioning, like, why? Why is everybody ill? Again, especially when you're in a residency in a hospital setting. And, of course, you normally don't see healthy individuals coming in to the hospital. You see people who are ill, and you're just bombarded with it all day, every day, and you don't have somebody, even from my side of things, when you treat somebody, or even something as simple as you prescribe a pair of glasses, you don't really get the positive feedback that they're happy with the end result. You only get the negative aspect, the complaints, the issues. You never hear that you did a good job, and so it can become a negative aspect. So I think, like you said, there's a lot of mental health that, as practitioners, I've listened to some other of your podcasts, and I think that's a big aspect, and just knowing how to deal with those tough situations and seeing negative parts. Yeah.
No, I agree, especially with the direction that things are going. There are a lot of sick people in this country, and it's going to get worse before it gets better, unfortunately, So I think that's why it's important that there are people like you that are in the healthcare field, but also talking about lifestyle medicine. So obviously I'm a big proponent of lifestyle medicine, and I feel like it can apply to every single profession. You're an example of that. So let's go into that. Why is what we eat so important for eye health? How does our diet actually affect our eyes?
That's one of my favorite things to think about, and I really need to advocate more loudly about this. So your eyes are one of the most highly metabolic tissues in the body. It's really an extension of your brain. And if you think about, I don't remember the exact statistics, but I think like your brain absorbs like 1/5 or 20% of the glucose that you use in your body. It constantly is requiring metabolic energy, the amount of oxygen that it's using. It's somewhere in that. It's like 20-25% of both the oxygen and the glucose metabolism. It all goes to your brain. And the retina in the back of the eye that gives you your eyesight, it's kind of the satellite receptor that picks up all this light energy. It's constantly, from the moment you wake up and you open your eyes, it's constantly being bombarded with light energy, which creates reactive oxygen species, oxidative stress. So your body needs antioxidants. It needs these micronutrients to help support this tissue and essentially recharge your retina. Because that's how the photoreceptors work, right? The light energy hits the photoreceptor. The photoreceptor gets used up. It sends the signal down your ganglion cells through the axons to the brain. But when light hits that photoreceptor, it's like a battery that has its charge 100% used up. And then your body, your retina, takes that empty battery casing, and it needs to phagocytize or eat that battery casing and recycle it. And then it has to make a new battery to put in that place. And that's how the photoreceptors are constantly cycling that way. At least that's how I like to think about it. And so your body has to have enough micronutrients to constantly heal this, make new batteries to eat up the dead battery. And so if you're somebody who has poor micronutrient levels, if you're not eating a good balance of fruits and vegetables, and really more vegetables, right? Then that could end up leading to deficiencies and potentially even retinal diseases like macular degeneration as you get older. But then there's, of course, other aspects. And this is, again, more of my real understanding and my aha moment when I was in optometry school and in residency was, and even kind of my drive into being more plant-based, was how the back of the eye is a giant meshwork of blood vessels. And if you have diabetes, high blood pressure, all of these, if you are eating a bad diet and you have a poor lifestyle, you're not exercising, your blood vessels get damaged. And if the back of your eye is nothing but blood vessels, you're increasing your risk for hypertensive retinopathy from high blood pressure, diabetic retinopathy. You can get cholesterol plaques in the back of the eye. You can have a stroke in the back of the eye. Unfortunately, we're all reactive in nature. And we feel like we see just fine, our vision's fine, and so unfortunately not everybody has a routine eye exam. And a lot of us don't go into the eye exam expecting our doctor to tell us bad news, but sometimes we do. But anyhow, so I think that's one of my biggest motivating factors for all of that, is how important eating a good, healthy diet of lots of fruits and veggies are great for the retina and supporting it, preventing disease, but also, again, eating a diet that is cleaner, less problems with cholesterol, less issues with the sugar, to keeping those blood vessels working the best they can.
Yes, beautiful. And you said something earlier that I think the common person would probably not link. You talked about how when you started looking into the research for a plant-based diet, most of it was about cardiovascular health. Well, just a regular, Joe, I would say Joe, but your name is Joesph. Isn't that funny? The regular Joe, not the optometrist Joesph, would be like, well, that's, the heart. What does that have to do with the eye? And I think as health professionals and the way that medicine has been distributed, you have these organ systems, right? You're a cardiologist, or you're a kidney doctor, or you're a liver doctor. And so a lot of times we don't put these things together. But why is it important that we take care of our heart and our cardiovascular system for our eye health? How is that connected?
Well, like I was saying before, it's all about the blood vessels and how high blood pressure, cholesterol, diabetes, these are kind of the big three, right? These are the ones that you're always worried about. Well, if your heart is struggling and your arteries are struggling, then same thing for the eye. Mainly when it comes to, like, let's say diabetes, for example. Somebody has increased insulin resistance, they have eventually prediabetes and diabetes. The amount of sugar in their blood vessel will eventually cause swelling of a pericyte within the actual lumen of the blood vessels. And those certain pericytes, they control how well the blood vessels are able to dilate and constrict, as well as how leaky and permeable these blood vessels are. If that happens, then eventually these parasites die, and then your blood vessels can't react, and they can't control how the oxygen and nutrients is passing into the retinal tissues. And then we start seeing hemorrhaging in the back of the eye, because blood starts going from the blood vessel directly into the tissue, and we start seeing bleeding spots. And then you get inflammation, eventually cell death, and then you can even get macular edema, swelling of the retina in the back of the eye. And it just cascades and gets worse and worse. And that's kind of the easy spot. That's kind of the very basic understanding of how diabetic retinopathy occurs. But same thing, to go back to cardiology, it's all connected. And so if you're eating heart healthy, and cardiac disease is like one of the top killers of all Americans, and has been for 60 years or something. I think before World War II it wasn't as high, but it's just across the board. And so stroke, cardiac disease, all of this combined, significant mortality rate, but it also is all linked to the eye. And so that's again why I'm just like, if it's good for the heart, it's good for the eye, that's what we should be advocating for.
Beautiful. I love that. Well, if you could tell people one thing that it would be your dream come true for them to change in their diet for eye health, what would it be?
leafy greens. Everybody, it's funny because the whole carrot thing, everybody says, like, eat more carrots, right? It's good for your eyes. That's actually not entirely true. I mean, carrots do have a role. The beta carotene, the vitamin A is good for the eyes, but it's not going to be as good as green leafy vegetables are. And I don't even like to tell patients eat more vegetables. I tell them to eat more leafy greens, because a lot of people that hear vegetables, they're like, oh yeah, potatoes a vegetable. Well, it's like,
everybody eats corn.
Yeah, yep. I mean, I grew up here in the Midwest in Minnesota, and that's what we had growing up. I never had vegetables, really. We had, corn or peas. Usually not even peas, because my dad didn't like them. So it's I don't remember really what we had for vegetables. Or if we had them, they were just drowned in butter. But leafy greens, mainly because of two antioxidants, and that is lutein and zeaxanthin. They are incredibly highly concentrated within the retina of the back of the eye, right in the center bullseye of the retina. That gives you your sharp 20/20 acuity, that gives you your color vision, your ability to read, recognize faces. Those nutrients are highly concentrated there, and across many, many, many different studies, find that people who have more amounts of this in their diet, and usually the average American is about 4 or 5 times deficient of what the recommended amount is for lutein and zeaxanthin. But people who have higher amounts have decreased risk for macular degeneration. They typically score better on their vision tests. They have better contrast acuity, better color perception, and again, just decreasing your risk of like lifetime oxidative stress within the retina. So there's a lot of benefits to it. Even reducing your risk for cataracts too. So that's another benefit.
Leafy greens comes up again and again and again from experts on my podcast, and they're just such a great food. They're the biggest bang for your buck when it comes to producing nitric oxide, which is also really important for our blood vessels. Just like you were talking about before, opening the blood vessels up so that we can get more blood flow, more oxygen to different places in our body. It
also plays a role in glaucoma too.
Absolutely. I did a podcast episode just on leafy greens, and I think the average American across the board, if you average it out of how much our intake is really eating like about a teaspoon of leafy greens per day. So it's extremely, extremely low. So there's a lot of people that are starting at the bottom. But if you could have your way, how many times a day do you think we should be consuming them? Is there a certain way that you feel like it's best to prepare them to maximize the lutein and the zeaxanthin? Is that what it is? Zeaxanthin? Is that how you say it?
Zeaxanthin is how it's pronounced. So I personally, I am not a huge... I have never been a salad person. I've been growing in the aspect of like, I can sprinkle it a little bit here and there in different foods. Whenever I can, I try to throw it in something in there, try to hide it. But my big thing is I just do shakes in the morning. I am, and it's not just like a little bit of spinach and a little bit of kale. It's like 90%. My other friends think when they taste it, it's usually gross. They usually tease me that it's, when I have my shake, I like to chew it. It's like... but no, that's how I do it. But what's interesting is, at least for the absorption of the nutrients, I have read that it's better to have it warmed up in some way, whether it be, I'm not sure, microwaved or boiled, or at least that increases the bioavailability of what I've understood. Mm-hmm. And I'd love to hear your thoughts on this. The only confusing thing is that I've read like the tables that are for regulatory purposes, like US FDA, they've like listed the absorption tables of like 1 cup raw spinach, and then they say like 1 cup cooked, and I'm always just like, they didn't really specify, is that like raw spinach of 1 cup raw spinach that they've cooked down? Because once you cook it, it like condenses, and I'm just like, I don't know, like, because they have it in cups, they don't have it in like ounces, and I'm like, I don't know if that changed it or not. I don't know the values, but
yeah.
I would love to know your thoughts.
No, it makes it confusing, and I do have listeners from all over the world, so sometimes people write me and they'll say, you said that the USDA recommends this many cups, how much is that in grams, you know? And so I realize it is kind of imprecise the way that we measure things. It really would be better if we weighed things like everybody else does, but and I can't keep up with all the different nutrients, but I know that Dr. Esselstyn, he treats patients that are like at the ends of the road where it comes to heart disease and cardiovascular disease, and he wants them to eat leafy greens 5 to 6 times a day medicinally, like it's a medicine, like they're taking a kind of medicine, and he wants them to either steam them or boil them and then add some sort of acid, so a lemon juice or balsamic or something like that, and that increases the absorption of nitric oxide. But I can't keep up because every single nutrient, something different happens, whether you put it in a smoothie or you cook it or you steam it or you boil it. But in general, I think that if you're boiling something and you're drinking the water, then you can still retain more of those nutrients as well if you're going to go the boiling route. But like you were saying before, what I tell people, you know, we could get nitpicky about these things and we can micromanage, but it really doesn't matter unless you're willing to actually consume it, right? So I could say the best way for you to get your leafy greens is to eat like 5 huge salads a day. And if you're like, I'm just not going to eat it that way, eat it the way that you're most willing to eat it, because at least you're getting it. It's better to get it than not get it. You're going to get some nutrients, whether you're having it in a smoothie or raw or whatever. If you're not eating it at all, you're not getting any nutrients. So take it in the form you're most willing to consume it. That's my advice.
That's and that's definitely kind of how I tell patients as well. So part of our protocol at our clinic, we have a device that it's called an MPOD, macular pigment optical density, and it helps figure out how much pigment is in the central macula of the eye, and there is a correlation with dietary intake of these lutein, zeaxanthin amounts. And some people just tend to have a higher standard amount, whether it be because of their diet, lifestyle, maybe some genetics. But when I have somebody who's a lower amount, I always talk to them about first their diet. Mainly because I am such an advocate, like, no, this is not just good for your eyes, it's good for your whole body. Mm-hmm. And I give them my example. I'm like, because again, we're here in the Midwest, and some people are just, they're steak and potato people. And I start telling them about spinach and kale and, you know, arugula or just other, you know, Swiss chard, all this different stuff. And they're immediately kind of put off. I'm just like, try finding a recipe for spinach, a banana, some peanut butter, and blend that up. Give it a try. It's remarkably tasty. And I think, yeah, if you can get it in somehow, even baby steps, if you're just starting out, just trying to get it in somehow.
I love it. All right, well, let's talk about other lifestyle habits, because diet is super important. It's my favorite thing to talk about. But I'm sure there's other things that apply to eye health. So tell me, what other lifestyle habits are important for maintaining healthy eyes?
The big ones that almost every doctor will kind of tell you about is certainly wearing sunglasses, and that's because of UV light penetration into the eye. Cataract development faster with sunlight exposure. There are a lot of epidemiological studies showing UV light and potentially even blue light increasing the risk of some eye diseases, namely macular degeneration. Epidemiological studies, they are what they are. Usually it's not the best information for studies, but it does give us a lot of understanding and guidelines for risk. The other big thing that I am, again, going back to is always exercise, mainly because it's all about the blood vessels again, and the more exercise you get, better control of the blood vessels you have. So those are the big ones: diet, exercise, UV light protection, whether it be sunglasses, wide brim hat. Those are always fantastic. And it's not just protecting the eyes from UV light, also the eyelids. The eyelids, I think it's a pretty high percentage that people will have some form of skin cancer on the lower eyelid at some point in their life. And the top eyelid doesn't get it as much. The top eyelid. The lower eyelid doesn't get as much because the brow protects it a little bit.
And now for a very important message. Hey mama, if you are feeling frustrated about mealtime battles, worried that your child isn't eating enough or eating enough vegetables, afraid that your child is going to get some awful deficiency or disease because of the lack of diversity in their diet, I wrote a book that might be for you. A Parent's Guide to Intuitive Eating, How to Raise Kids Who Love to Eat Healthy is available in paperback, ebook, and audiobook through all major online booksellers. Did you know that most children are born with the innate ability to eat the appropriate amount of food to satisfy their hunger and support appropriate growth? Despite this, parents are still anxious and confused about how much and what to feed their children. In addition, many children are labeled as picky eaters or develop behaviors such as hiding and sneaking food. There's also a growing epidemic of dieting behaviors and eating disorders beginning at alarmingly young ages. In my book, you'll learn the 5 pillars of healthy eating, how to apply intuitive eating through all the stages of development, lifestyle habits that support healthy eating and body image, troubleshooting and problem solving for picky eaters, overeating, and dieting behaviors, how to create and foster a healthy body image in your children, how exploring your own body image and relationship with food will help raise an intuitive eater, and what foods to offer your child at different stages of development. A Parent's Guide to Intuitive Eating, How to Raise Kids Who Love to Eat Healthy, available in paperback, ebook, and audiobook through all major online booksellers. Are you ready for a fresh approach to feeding your child? For more information, visit dryami.com/book. And now, back to the episode. Yeah, that makes sense because the skin there is just thinner and just more susceptible. I live in Yakima, Washington, which is central Washington. A lot of people hear Washington, they're like, oh, it must be rainy there, but it's a high desert where I live. So we have 300 plus days of sunshine per year. It gets very sunny, and I'm very interested in longevity and protecting myself. And of course, now that I'm the age that I am, I'm having my grandparents, everybody's getting surgery for cataracts, and I'm just like, oh man. And I'm originally from Panama, so Panama obviously is a very sunny place right next to the equator as well. So I have been very mindful about making sure that I am wearing my sunglasses and putting my sunblock on and wearing my hat. But now I feel like I'm getting to the extreme because I just bought some driving gloves. I learned this from a dermatologist on Instagram, so that whenever I drive, I can protect my hands so I don't get like old lady hands too early. So I'm like completely covered. I have this hat that goes around and like clips in front of my face, and it's kind of ridiculous. But I'm hoping that when I'm 80, I look 40, you know, like take 40 years off if I do the work now. So
that's how I think about, I try to put things in that perspective all the time, especially like when it comes to my teeth. I'm like, no, I need to brush and floss and take care of my teeth because someday these things may be falling out, and I want to postpone that as long as I can. There's so much aspect to that. I love that. I've never thought about the driving gloves for UV light exposure on the hands, but interestingly enough, a lot of truck drivers, like professional drivers, the front windshield has UV light protection built into it. That's why like transition sunglasses, they don't work. Mm-hmm. They don't work in the car. But it's your driver's side window that doesn't have the UV light protection.
Right.
So interestingly enough, a lot of professional drivers, their left eye will develop cataracts sooner than their right.
Whoa, that's crazy. Yeah, because I was telling my husband, he's like, well, you're in the car. And I'm like, no, because you know that your left arm is more likely to get melanoma or skin cancer than your right arm because of driving. So yeah, I'm going to be protected, hopefully. But it is, I think you get to a certain age, and that's when you start thinking, because when you're young, you're like invincible, right? You're like, whatever, I have so many years, it doesn't matter. And you get to like the middle of your life, and you're like, oh man, I really need to start thinking about this.
I think a thing that's been impacting my family, or personally a little bit more, is my mother. She's getting into her 60s, and she's having some subtle memory issues, and she is actually going to go see a neurologist to figure out if it's something that's just part of normal aging or if it's something more. And I've been listening more about research on how sleep can potentially, or lack of sleep can influence your increased risk and rate of Alzheimer's, dementia. And so I've been really trying to focus more on my sleep quality over the last several, probably last year and a half, 2 years.
Yes, I have 2 amazing podcast episodes with the Scherzeis. I don't know if you've read their book. And also another book that I recommend if you haven't read on sleep is The Circadian Code. It's so good. Really, really good. I love those.
Thank you, yeah.
Well, hopefully she gets a good visit and a good prognosis, and it's just something simple that can be addressed. What do you think is a big mistake that people make when they're caring for their eyes?
Probably the biggest one is people don't go in to have a routine eye exam. Some people do. But the vast majority of people, they usually don't. They don't go in unless there's something wrong. Like, they notice, oh, I see just fine. And it's like, unfortunately for most eye diseases, they don't affect your vision until it's too late.
Yeah.
So that's the biggest thing. Even, I can give so many examples when I have a patient who came in thinking their vision was fine. They just wanted an update in their contacts, their glasses. But then I end up finding some bleeding in their retina, or I end up finding even potentially cancer or something else more devastating. And so I always recommend for everybody, even if you end up not needing glasses, that's fantastic. It's still important to get those eyes checked out and examined. So.
At what age do you recommend that patients start coming in regularly for their eye exams?
So I'm glad that you asked this. So the recommended times, as early as between 6 and 12 months of life, should be the first eye exam with an eye care professional. And thankfully, in many states here in the U.S., they have what's called an infant C exam. So people who don't have insurance, or they can't afford an exam, they don't have vision insurance, for example, they can find a provider in their area through that program. And I think every state is different. But they're able to find a provider, and they'll just get that infant exam for free. The provider will do it, no charge. And that's just to make sure that everything's developing correctly, that there's no major issues. After, let's say everything works great at that point, everything's fantastic, then around age 3, and then the next milestone is about age 5, 6, before going into kindergarten. Because so much of the world is learning language, reading becomes more important. And this is, unfortunately, in some states, like the state of Chicago and Illinois, the state of Illinois, they actually, it's a requirement that children have an eye exam before going into kindergarten. And so that allows for doctors to catch things like amblyopia or lazy eye, strabismus, other deficits in their vision, kids who have high hyperopia, or anisometropia, or one eye's farsighted, more farsighted than the other, all the different things. And so those are the critical times. After that kindergarten, age 5, 6, then yearly from there on is recommended.
Okay, that's good to know. Yeah, as a pediatrician, I'm screening children. I'm doing their general exam, which includes the eye, and then usually around 4 years old is when I start doing a basic vision screening. But what I tell parents all the time is like, this is like super rudimentary, and if there's any discrepancy or we're not sure, I always refer. But I'll look into that program and see if Washington State is one of the states that has it, because I think as a pediatrician it would be really helpful, since I don't have expert training in the eyes. I can catch major things, I can look for symmetry and things like that, but I'm not doing the exams that y'all do.
And I have a lot of respect, of course, for everything you're doing, because you're looking at the whole body. You're looking at not just the eyes. You got all these things you have to worry about. And for us, when it comes to the eyes, especially for young kids, their accommodative, their muscle system is so much stronger. So for a lot of kids, I know a lot of clinics, at least where we're at, they'll have like a handheld digital device that kind of reads their eyes a little bit. It's really just an autorefractor that makes bells and whistle noises to keep their attention. And unfortunately, for a child that's having that done, if they're not having their eyes dilated, or cyclopleged is the proper term for them for young kids, then the autorefraction is not really that accurate, because they could be using their muscles to fool the instrument. So when we do see a child usually under the age of 7, we dilate pretty much every patient in our clinic, but under the age of 6 or 7, they actually get drops of cyclopentolate to inhibit their accommodative ciliary body muscles, so that we can get an accurate prescription and knowing really where their eyes' powers are at.
Wow, see, that's just like way over my head. So thank you for what you do, because, yeah, I couldn't even begin to do any of that. Speaking of, you wrote, when I was learning more about it, one of the things that you are highly interested in is the myopia epidemic, which kind of made me wonder, I mean, is there something we can do about this? First of all, explain myopia for people that don't know what it is. And so tell me more. What does that mean? And is there something we can do about it?
This is a really good topic, even maybe even more so for you, being that you're all focused on pediatrics. So myopia is the fancy medical term for nearsightedness. And the myopia epidemic is even a bigger deal now because of COVID. And the way this is our eyes, through development from a young age as we get older, as we all go through growth spurts, right? But the eyes in myopia development actually grow longer. So if your eye grows longer, then you also end up with a higher amount of nearsightedness. And historically, for humankind, this has never been a serious or a huge issue, because if we're thinking, like, if we're going back like 1,000 years, how many people were actually learning how to read and write? How many people actually stayed in their schooling education, till they're 18 years old? Now, our education system is so well developed, and so many people are expected to start learning to read, write at a young age, and then stay in school for 20 some extra years of their life. Like, we're all going to college, and then some people beyond. And we're finding that not just genetics increases your risk of needing glasses, corrective eyewear, but also your lifestyle, the nature-nurture debate. The nurture aspect of how you live your life strongly does influence how your eyes develop and grow stronger. And so the easy way of saying it is that young kids who already have a genetic susceptibility, especially with parents who are already nearsighted, like my mother, she was like a -10. And so I already have an increased risk of developing needing glasses, which I did. At age of 6, 7, I got my first pair of glasses. And so kids who spend more time indoors, who spend all day in front of a computer screen or a book, like 6 inches in front of their face, they're sending a signal to their brain and to their eye to reform the sclera in the back of the eye, the white part of the eye, and that actually causes the eye to grow longer and increases the power of their focus and ends up causing them to be more and more nearsighted. So if you fast forward to, that's already becoming an issue. Then you fast forward to COVID, and everybody's indoors, and all kids are being stuck with an iPad in front of their screen, in front of a screen for 8+ hours a day. And so we're seeing dramatic increased rates of kids having stronger prescriptions, and increased amount of prescription strength is not only a burden on the child for the rest of their life, thinking of glasses, contacts, all of that, but then their increased risk of retinal detachments in their life, increased risk of glaucoma, cataracts. It continues to build, including what's called myopic maculopathy. It's similar to age-related macular degeneration, but it's basically where they lose their sight as they get older as well.
And that has more to do because of the shape of the eye, because of how it elongates?
Yes, exactly. It's basically the retina stretching out, and because of the way the photoreceptors are, the back of the eye, the photoreceptors, the retina is given its structural stability by this deeper layer of the retinal pigment epithelium, and eventually it just starts to break down and it can't spread its nutrients correctly. There's a lot of kind of research going into it, but it's a concern right now for all healthcare, mainly for the eyes, and there's a lot of research going into ways we can help with this. New glasses lenses that are being invented that are showing in studies to slow down the rate of nearsighted development, contact lenses, and of course making just recommendations to parents and to teachers to basically, once kids are done with their schoolwork, they should be going outside. They should not be sitting in front of a Nintendo Switch or their phone or an iPad for the rest of the evening.
Yeah. There's so many reasons why that would be beneficial. And as they start to get older, they start to get into that middle school, even a little bit before, kids become so sedentary and they are just in front of screens. Even before COVID, this is really a problem. So it's not just going to benefit our eyes, but it's going to benefit our bodies to kick the kids out, go play outside. Now, I've read a little bit about this and how it was different, back a long time ago when we were outside, we're looking at things further away instead of everything being close up the way it is now. But wow, I had no clue. Now, is it possible to reverse myopia? Because I've seen websites out there talking that it's possible. Is it possible? Yes or no?
It is not.
Okay. Well, good. So I'm glad you said that, because otherwise I'd feel bad that I didn't work harder to reverse mine.
We've at least found ways to slow it down, but I have never seen any credible sources, and I've dug into this because I've seen these other websites making these claims, and largely from my deep understanding of how these, I can't even say they're scientists, but these people who are making these claims, they are probably, a lot of it has to do with orthoptics or vision therapy. That's not used in clinical settings. These are usually individuals who are probably already over focusing their eyes, their eye muscles are more or less fixated in a very tight position, and then they're basically learning how to relax those muscles and not be so over focused. But in the clinic, whether after surgery or we use cycloplegia to paralyze the focusing muscles, we don't see it just bounce back to zero. It doesn't happen. It doesn't work that way because the axial length of the eye has stretched out.
That makes sense. It makes a lot of sense. I'd love to know if you have any incredible eye health transformation stories that you can share with us.
So I have so many different stories, and I love to share them all. I wish we could have had all day to talk about things. So for me, I love helping people. I'm sure you have this moment where somebody's really struggling with something. Maybe they've seen multiple providers and they just aren't getting an answer, or they're not getting a resolution of something, and then you are able to kind of figure out what to do and solve that problem for them. And that makes you just kind of you get all excited about it. I had a patient who had a condition called keratoconus, where the front surface of the eye, the cornea, starts to thin degeneratively over time, over their lifetime. And this causes severe warpage of the front surface of the eye that actually makes it look like a cone protruding from the eye. It actually becomes kind of pointy. And with this, they have severe levels of astigmatism. And a lot of people will they're told by the doctor, oh, you have astigmatism. And that's very common. And most people don't have that much of astigmatism. But people with keratoconus have a severe level of it that's progressive and constantly changing. And this particular patient, she was middle-aged, and with her glasses, she was barely legal to drive in the state of Minnesota, which is about 20/40. So she hasn't seen 20/20 vision for a long, long time. And one of the best treatments that we have for at least improving acuity, and anybody who's listening to this, if they have a family member who has keratoconus, what's best right now, as of new developments in technology, is something called corneal cross-linking, which is where we put riboflavin on the surface of the eye, and then they actually cure it using UV light, interestingly enough. But it strengthens the surface of the eye so it doesn't become progressive. It doesn't continue to thin out, because if in end stages of the disease, people need transplants, a corneal transplant. To improve the vision, though, you can have a doctor like myself who has experience in fitting specialty contact lenses. They're not just like the soft lenses that you throw on the eye and people wear them and they're like, oh, yay, this is great. But scleral lenses, the ones I'm talking about, they're large fitting, hard plastic lenses that vault completely over the cornea. So they rest on the white part of the eye, 360 around the cornea.
Whoa.
And they're very difficult to fit. As a professional, you have to have experience in school, and then you have to experience working with products and with manufacturers and all the different technology. But I was able to fit this one patient, and even in the exam room fitting her, once I got them on her eyes, she started crying because of how well she was able to see. And it was like the first time she was able to see, and she wasn't even hitting 20/20 at that point. It was like 20/25, so one line worse than 20/20. But she was just crying because she hadn't seen that sharply, that clearly, for like 20-some years. And so with fitting those, we have to let them settle and rest, because they have to settle down in the eye for about 20-30 minutes at the very least. So I had her wait out in the waiting room. And this was great for our practice, because she was just walking around looking at everything and telling everybody in the office like how amazing she's able to see. But just that just made me really happy for what I do and how I'm able to help some people. It kind of restores your excitement and just love for your profession.
Yeah,
So
that's
that
a
was
beautiful
good
story. That's so beautiful,
Yeah.
because we take it for granted a lot, right? The ability to be able to see, or even for some of us that have some eye difficulties, just putting on a pair of glasses or a contacts, and yeah, you're good to go. But somebody that had been to multiple doctors, probably lost hope, was about to get her driver's license maybe taken away because she was about to not be able to drive because she couldn't see well enough, and you completely changed her life. That's amazing. So that's so beautiful. Thank you for sharing that story.
Thank you.
What do you wish more people knew about eye health?
Probably just kind of what you mentioned, that we often take it for granted, that just because you think you see fine doesn't mean that you don't have a lurking disease that could be sneaking up behind you. Mm-hmm. And it's not necessarily just within the eyes, but it's systemic diseases that can show up in the eye. Like myself, I have a mole in the back of my left eye, which is my dominant eye. And that mole or nevi has the potential to grow and become cancerous. And if it did, the number one place it travels to is your liver. And if that happens, there's a 99% mortality rate within 5 years. So it's serious. I think the fact that we just say, oh, my vision's fine, oh, I don't need to see the eye doctor. It's like, no, you really should be doing it on a regular basis.
So the nevus is where?
My nevi is in the back of my retina. Technically, it's in the choroid, which is a meshwork of blood vessels behind the retina. And so I have a choroidal nevi in the back of my left eye, or nevus.
I didn't even know you could get it there. I mean, that's amazing. Wow. I mean, it's kind of cool in some ways.
I think for Caucasians, it's somewhere around 7 or 8% of people will have them. I don't remember the last time I read that particular study, but it's thankfully it's not very often that it becomes cancerous, but it can be very serious, as I kind of just said.
Wow. Well, it's a good thing you get your regular checkups and you know who to see if you need that. So.
Absolutely. I mean, I've got 5 other doctors in our clinic who are more than happy to do my eye exam. So.
I love it. All right. Well, what personal habit are you most proud of, and why?
For me, I know, of course, we've talked a lot about this. If this was anybody else, if this wasn't talking with you on your podcast, I would probably say my diet, because of how difficult it was for me. I think even still, in the culture that we live in, There's a lot of different opinions about diet or health from all different places, and I still get, you get bombarded by at different advertisements talking to you saying like, oh, eat beef or eat this, and even my other, I've had people at our clinic and my colleagues, actually the ophthalmologist I work with, he teased me for 4 or 5 years that every day I showed up with lunch and I'm sitting there eating a salad and all these vegetables. He's like, you're still on that health kick, huh? And he's over there eating McDonald's. And then he's getting cool fat sculpting done to help him like lose weight and improve his appearance. And I'm sitting here, it's like 5 years later. It's not really a health kick if it's not really a diet anymore. This is my lifestyle. And so it's certainly challenging to stick with it, because there's still times I'm just like, darn, I want pizza so bad because I miss that taste. But and I don't mean the good pizza where it's like got the new vegan cheeses and stuff on there. I'm like, sometimes I just crave like a
good old fashioned American pizza, right?
Yeah, or burgers, chicken wings are a huge like weakness for me. So I have to rethink to myself why I'm doing this, and just like that, do I really need it? And then sometimes I'll just drink a big glass of water, and then suddenly I'm not hungry anymore. So I would say that is my biggest lifestyle change that's really helped me.
Yeah, well, I commend you, and thanks for sharing that, because I'm just going to point something out that I've talked about before on my podcast is, for those of you that aren't watching it on YouTube, Dr. Allen is a very lean, handsome fellow. And I think that we have these biases that when we see people that are lean, we assume that they're, one, naturally lean, and two, that it's easy for them to just eat the way that they do or have the lifestyle that they do. But I think it's important that we try as much as we can to remove these biases from appearance, because then we assume the opposite for heavy people, for larger bodied people, that, they just eat bad all the time and they don't care about their health. But what you're saying is that you too are human, and sometimes you just want to dive straight into a big bowl of chicken wings, right? But you say to yourself, that's not the best choice. That doesn't align with my goals. That doesn't align with my values for my own health. And so I'm going to make another choice, even though it feels difficult in this moment.
And what's funny is that the few times when I have, my weaknesses have gotten the better of me, and I have like eaten something, I never feel good about it like 20 minutes later. I always feel like I feel bad, either like physically, like being in tune more with my wife and I are always trying to focus more on like, what does our body really feel like?
Yes.
And I think more recent podcasts I listened to of yours kind of talked about that, and kind of being in tune with your body and feeling how it really feels. But I never feel good after I let myself go and eat like a slice of pizza or something. So it's something, and I guarantee everybody who's maybe starting their journey or even have been, eating very strict, healthy diet for years, there's times when we all have moments of weakness, right? Mm-hmm. And it's just part of being human, and it's okay to sometimes to make mistakes too. So
yeah. No, and what you were talking about is how you feel after you make one of those choices that you don't feel as well. That's called anchoring. So I work with this with my clients as well, that when you make that choice and afterwards you're feeling bloated or heavy and not good, memorize that feeling and anchor it, so that next time you're considering making that choice, it's an informed choice, right? Because the marketing part of our brain tells us, don't worry, it's going to be good. It's going to be all good. It's going to be 100% good. But you can be like, actually, I have some data here. I have a memory from the last time I made this choice. And given what I remember, I don't think I'm going to make this choice. So it ends up feeling more like a willing choice rather than a restriction that you've put on yourself. So it's a very wise thing that you have learned. Well, Dr. Allen, this has been great. Thank you so much for your time. I know that you are very busy for the listeners out there, Dr. Allen's pretty much famous on YouTube. So I'm glad that I was able to get some of his time for a famous YouTuber to be on the podcast. Definitely check out his videos. There's so much information. I've watched a few of them, very informative. Anything you need to know about eye health, definitely check him out. But I would love to hear from you. How can listeners connect with you? Do you have any products and services you offer? Where you work? Are you taking patients? Give us all the details on that.
Thank you so much, Dr. Yami, for that. So yes, I do practice. I work at the Pinecone Vision Center in Sartell, Minnesota. I do that half the week, and then I actually produce content on YouTube, as you were mentioning, which has kind of been my passion for the last 3 years. I really found I love public education, and I want more people to know about the eyes, about health, and how I really want to empower people to understand what's going on with their health, because then I feel like they're better advocates for themselves and how they can heal. And so my YouTube channel is called Dr. Eye Health. When I first started it, my best friend who's in marketing, I didn't know what to call it, and he said, just pick 3 words that you want people to remember about it. And I'm like, I want people to know that I'm an eye doctor, that's about the eyes, and it's about keeping them healthy. So it's called Dr. Eye Health. So you can check out all of that for information about the eyes. You can learn about glasses, lenses, contact lenses, retinal diseases, cataracts. Dry eyes is a big thing I'm very passionate about. And it's just, I never run out of content to talk about. The hardest part is finding time to make content.
Yes. I hear you on that one.
As you know, yeah. So, yes.
Well, and Halloween is coming up next month. You have an episode on Halloween lenses. I am totally going to look into that because I would just love to do that. That would be so fun, and my patients would love it.
The big thing about the Halloween lenses specifically, and I'll just give this to you, is to just definitely see an eye doctor in your area about them, because most of the Halloween lenses that are made out there are not FDA approved, and they're made in other countries where there's no regulatory body on them. And you'll hear this in my videos, most of them are made of material from the 1960s.
Ugh.
So they're not healthy for the eye at all. Not until mid-1980s did studies end up finding out that the oxygen percentage of how much oxygen gets to the cornea is needed to prevent hypoxia, neovascularization, decreased risk of corneal ulcers. And so these lenses are very far behind in technology, and that's why they're not even approved to be made and manufactured in the United States anymore. So,
not fun. Yeah, hypoxia is not good. We like the oxygen.
Yep, and as long as your doctor can fit them, feel like that is a good lens for you, and they can prescribe it for you, then perfect. But still, don't want to wear them. Certainly don't sleep in them. Don't wear them too long. But they are fun. They are fun for costumes.
Super cool. Well, Dr. Allen, thank you so much for your time. I appreciate you so much. I know that my listeners will love this episode, learning lots of fun tidbits about the eye. So thank you, and I hope that you have a very plantastic day. Hey, veggie lover. I hope that you loved today's episode. Will you take a second and do me a huge favor? Please subscribe to my podcast so that you never miss an episode. You're the reason I'm here, and I want to share it all with you. Thank you for listening, and have a plantastic day.